Okay, so this is Shaylee and I's presentation over gestational diabetes, and Shaylee will be coming in later. In this presentation, we will be going over the basics of gestational diabetes mellitus, and that is also known as GDM. We will start off looking at GDM and what it is and who it affects, and then also the factors that cause an increase of risk for women actually developing it. And then we'll go over the complications for both the mother and the baby and how GDM is diagnosed and managed throughout pregnancy. Lastly, we will look at the long-term effects like future health risks and then also treatment options. And this just helps to give an overall picture of GDM and why it's important to understand and properly manage throughout pregnancy. What is gestational diabetes? Gestational diabetes is the development of temporarily high blood glucose levels during pregnancy. It is temporary and it is caused by hormonal changes that lead to insulin resistance, meaning that the body's cells don't respond to insulin. So although it does go away after delivery, it can increase the risk of developing type 2 diabetes later in life if it was not properly managed during pregnancy. Type 1 diabetes is an autoimmune disease where the immune system attacks the beta cells in the pancreas that actually produce insulin. This means that people with type 1 diabetes produce little to no insulin, and they will require lifelong insulin therapy to survive. Type 1 is not preventable and is thought to be linked to genetics also. Type 2 is usually developed in adults and is often a result of lifestyle choices like poor diet, lack of exercise, and obesity. So the main issue is that the body's cells just become unresponsive to insulin, which may result in the pancreas producing less insulin over time. And then insulin resistance in gestational diabetes. In early stages, insulin is produced correctly because the pancreas is able to compensate a normal amount for the baby. But as pregnancy continues and gets later, the baby grows larger and the demand of insulin increases, and oftentimes the pancreas can't keep up, leading to insulin resistance. For demographics, the CDC says that around 5 to 7% of pregnancies are affected annually. So those are at higher risk if they are overweight or have a high BMI, especially before pregnancy, because this increases the body's resistance to insulin and makes it harder for the mother to regulate blood sugar. And also, there's a higher risk for women who have had gestational diabetes in a previous pregnancy, just because they are more likely to develop it again, especially if it was not managed well before. And then also, hormones from the placenta interfere with insulin sensitivity and how it is taken in. And so, for some women, this hormonal shift causes an increase in insulin resistance. And then for ethnicities, studies show by the CDC a higher prevalence rate in these specific ethnicities like African American, Hispanic, Alaska Native, Native Hawaiian, and Pacific Islander, possibly due to just a mix of genetics, access to healthcare, and lifestyle factors. And then age is a big risk also. As we age, we just become less active, our body cells become less responsive, and bodily hormones change. And family history plays a role because of the susceptibility to insulin resistance shared through genetics and also similar lifestyle habits. And then the graph on the left just shows the common age group of mothers that develop GDM from 2016 to 2021. And we can see that as mothers get older, the percentage of GDM development also increases. Causes and factors. First off, the placenta naturally releases hormones that help the baby to grow, but they also interfere with the way that insulin works in the body. So this can cause insulin resistance, but it's why some women are more at risk than others, and it also can't be controlled. Polycystic ovarian syndrome is a chronic condition that affects hormone levels and can lead to insulin resistance. While you can't cure it, it can be managed with certain choices like healthy eating, exercise, and medication. Managing PCOS does lower risk of gestational diabetes, so it is partially controllable. However, physical activity is fully controllable, and staying active during pregnancy really improves the body's use of insulin. Even light to moderate exercise like walking, stretching, or yoga can help lower the risk of developing gestational diabetes. One of the challenging things about gestational diabetes is that it usually has no obvious symptoms at all. Many people feel completely normal and may not even know anything is wrong until they do go get tested. So when symptoms do show up, they are usually very subtle things like fatigue or increased thirst and more frequent urination. The problem with this is that those symptoms are also very common in a normal pregnancy, so they are easily overlooked and can also be seen as hormone changes or just simply being tired. That's why routine screening is so important, because it helps detect gestational diabetes early, even when someone isn't feeling any different than before. So most screening happens between 24 and 28 weeks of pregnancy. And that's because that's when the placenta hormones start interfering the most with insulin, increasing insulin resistance. So catching GDM early allows for better blood sugar control, and that can help prevent complications for both the mother and the baby. Diagnosis for gestational diabetes is done a few different ways. So the first step in screening is the glucose challenge test. It's usually done between 24 and 28 weeks of pregnancy, and this is where the patient drinks a 50-gram glucose solution filled with sugar, and then their blood sugar is checked about an hour later. So if the result is 130 to 140 milligrams per deciliter or higher, they will need further testing just to be sure that everything is working correctly. The next step is the oral glucose tolerance test. For this one, the patient will not eat overnight and then has their blood drawn for an initial baseline. And then after that, they drink a 100-gram glucose solution, again filled with sugar, and their blood sugar is tested later at 1 hour, 2 hours, and 3 hours. So if 2 or more readings from that test are above the target levels, then a diagnosis of gestational diabetes is usually made. Gestational diabetes doesn't only affect the mother, because it can also have serious effects on the baby too. One major complication is macrosomia, which means that the baby grows too large. This is often seen over 8 pounds and 13 ounces, and this can lead to complications during delivery, like shoulder injury to the baby or the need for a C-section. And this can be seen in the picture on the slide. On the left is a normal mother with a normal baby size and no GDM, but on the right is a mother with developed GDM and a larger baby. So another concern for the newborn is hypoglycemia. This is because after birth, the baby's pancreas may still be producing higher levels of insulin from being in the mother's womb, and this can drop their blood sugar too low once they are no longer receiving sugar from the mother. GDM also increases the risk of preterm birth, which can cause breathing difficulties and other problems because the baby is born when they are fully developed. And finally, there are long-term effects. Babies born to the mothers with GDM also have a higher risk of developing obesity and type 2 diabetes later in life, which is why managing gestational diabetes is really important, not just for the overall pregnancy, but for the mother and child's future health.
There are many complications that can come with gestational diabetes, specifically for the mother. One of the main concerns is preeclampsia, which is a condition that can develop during pregnancy. It is associated with high blood pressure as well as signs of damage to an organ system. That organ system is typically the kidneys, but can truly affect many different organ systems throughout the body. Additionally, with gestational diabetes, a cesarean section delivery is more common. Gestational diabetes is often associated with larger babies, also known as macrosomia, and that just makes vaginal deliveries more difficult and dangerous, and so a cesarean section delivery is often more likely. And finally, after developing gestational diabetes, a woman will have over a 50% chance of developing type 2 diabetes within 10 years after that delivery. And so it is very important to make sure to have those lifestyle changes implemented to make sure that both the mother and baby are safe. There are current treatments in place to lessen the effects of gestational diabetes or completely resolve it, which is amazing. One of the main things to keep in mind when developing gestational diabetes is to make sure that a healthy diet is present as well as getting regular exercise. For the diet, it's important to have a balanced low glycemic diet, just to make sure that you are regulating your blood sugar levels and having moderate physical activity. This could be walking, prenatal yoga, or swimming, just to make sure that your body is moving, which can significantly help regulate those blood sugar levels, as well as just keeping you healthy. Additionally, just making sure to monitor blood glucose. It is recommended that mothers with gestational diabetes are checking their blood sugar 4 to 5 times a day after fasting, just to make sure that those levels are staying in that target range, as well as being able to monitor if there are any spikes occurring and just keeping things regulated. And if none of those treatments work, there are some medications that are available. Insulin is typically that standard treatment, and it just helps regulate those blood sugar levels, keep them a little lower, as well as metformin, and this can be prescribed if insulin isn't the right treatment for that individual patient, or can be used as an additional therapy if the combination of all of those things is not enough. The most important thing when having gestational diabetes is to keep a routine. Like I said, making sure to monitor those blood glucose levels, as well as keeping that diet and moderate activity daily. For those lifestyle changes, it's very important to implement a few things just to make sure that it is more obtainable. One of the main things that can really help is meal planning, making sure that you have those low glycemic index foods readily available. This can just help keep that steady blood sugar, as well as making sure you're getting all the nutrients needed. Some common things with that diet are high fiber vegetables, lean proteins, and whole grains. Additionally, implementing that moderate exercise, making sure to do gentle activities such as walking, prenatal yoga, can help improve insulin sensitivity and help manage glucose levels safely during pregnancy, which is extremely important during that pregnancy as well as postpartum. And finally, just making sure to utilize mental health and support systems. Pregnancy can be scary enough, and so managing your gestational diabetes can be emotionally overwhelming. So utilizing your support from family, healthcare providers, and counseling can also help reduce stress and promote consistent self-care, helping both the mother and the baby long term. And then looking at postpartum and long-term management, it is super important that women are rescreened for diabetes 6 to 12 weeks after delivery, just to make sure that those blood sugar levels have returned to normal and there's not a spike, because as I shared before, type 2 diabetes can be common after gestational diabetes, so it's important to just make sure to do those regular screenings. Additionally, just making sure to continue those lifestyle changes, eating healthy, and getting that physical activity can help with weight management and significantly reduce that risk of developing type 2 diabetes. And then additionally, if for future pregnancies, it's important to have that early intervention and make sure to be monitoring it regularly, since there is a high chance of gestational diabetes reoccurring. Early screenings and proactive care is vital to make sure that both mom and baby are safe. Now on to future research and options. Making sure to utilize that continuous glucose monitoring. There are devices like CGMs that will offer real-time glucose tracking instead of utilizing finger pricks, just to make sure that blood sugar is managed effectively and regularly, to avoid any complications, as well as personalized treatments based on genetics. There has been a lot of ongoing research in this area, and so exploring how genetic profiling may lead to tailored treatment plans, which can reduce risks and improve outcomes overall, which is extremely helpful. And then making sure to expand screening and public health campaigns, making sure that education is widely accessible, as well as making sure that that early detection is available so that be proactive in treatment for both mothers and babies. And then to conclude, gestational diabetes is temporary, but it is a serious complication, and so making sure that while gestational diabetes can resolve after pregnancy and childbirth, it can have lasting effects if not properly managed, and so making sure to keep those lifestyle changes and regularly screen for diabetes is vital for both the mother and baby's health. Additionally, that early detection, treatment, and education matters, making sure that there are timely screenings and intervention can significantly reduce the risks for both the mother and the baby. And then finally, just a question to reflect on: how can awareness of gestational diabetes impact lifelong health for both the mother and the child? And these are our references. Thank you.